line is 0809 597 5805. That is 0809 597 5805.
Today, traditional medicine in focus, Shogoro community where pregnant women find succor in herbal homes. Remember that every Friday we have a partnership with the Wole Soyinka Center for Investigative Journalism, and every Friday we bring you one of those reports done by the female reporters on that program. And we have today joining us on the show, and we'll be looking at her report, Bumi Yakini from Radio Nigeria. Good to have you here. Good morning.
Good morning. Good to be here.
You're welcome to the show. We also have on the show today, he's on the phone line joining us, Dr. Bumi Omosheyindemi. He's in charge of the Lagos State Traditional Medicine Board. Good morning, sir. Thank you for joining us today. Hello, sir. Okay, we'll try to get him back on the line. But we have also Achike Chude with us in the studio, as well as Mrs. Adeyinka Olumade Kilani. She's Chief Executive, Olumade Natural Clinic and Maternity Home. Good to have you on the show today. Good morning, ma'am. You're welcome. Nigeria, we're live on Facebook and Twitter. What that means is you can watch us also on YouTube and leave us your comment on this conversation today. Also, let's remind you that you can leave us your comment on our WhatsApp line 08095975805 with a 42% reporting rate. No fewer than 14,536 deliveries were reported by about 342 registered traditional birth attendants in Lagos for the year 2015.
That's right.
So you can imagine what's happened in that time. The Traditional Medicine Board regulates the activities of TBAs in Lagos, including registration and renewal of licenses. Infant mortality rate measures the probability that a child might die between the time of birth and their first birthday. It is given as a number of deaths per 1,000 live births. As at 2017, statistics from the Healthcare Facilities Monitoring and Accreditation Agency shows that in Lagos, there are 26 registered general hospitals, 256 public healthcare centers, and 2,886 private hospitals. So our conversation today focuses on the role of traditional birth attendants in maternal mortality in Nigeria today.
Again, welcome to the conversation. We appreciate you joining us. Let's start with Bumi on the show this morning. What prompted you really? Why did you do this story?
Well, for a while now, I've been working on maternal health and with rural women.
Okay.
And I discovered a lot of challenges faced by these women, especially poverty is one of the driving factor of these women's challenges.
Poverty?
Yes, poverty.
Okay.
A lot of them fend for their family, even though they have husbands.
Okay.
But basically, their husbands are peasants, fishermen who does nothing else but wait and see what comes out from what the woman has to offer.
Okay.
And I realized that a lot of them have a lot of issues that are unspoken. People don't get to hear their stories. And when I started covering this issue, that should be around 2007,
Okay.
I discovered that they're only there for census purposes, population council. They come to
make up the numbers.
Yes, only numbers. That is all what they are there for.
Okay.
When it comes to basic infrastructural materials, they don't have it. Power supply failed. Hospitals, even primary health care center, the smallest, the minimal health care center, they don't have in most of these communities. So far, if I'm not mistaken, I should have been in over 20 communities in Lagos, and their problems are the same.
You mentioned fishermen as husbands. Are we referring to riverine areas?
Coastal areas in Lagos.
What impression does this leave you about Lagos being a metropolitan state? And you said you visited about 20 of these communities, and poverty is the same across these areas.
It's the same, yeah. Well, someone once told me that even the richest country in the world has a place like that, places like that. So it is not out of place to have people like that. And they argue it, that it doesn't have to be that way. It is not an anomaly. It shouldn't be.
Let's welcome 1 minute, please. Your namesake, Dr. Bumi Omoshayide. He's in charge of the Lagos State Traditional Medicine Board. Good morning, sir. Thanks for joining us on the show today.
Good morning.
Thank you so much. Now,
point of correction, I'm not the one in charge of Lagos State Tradition. I was, but I'm no more there.
Thank you. Thank you so much for pointing that out.
Thank you.
Now, we have a report done by Bumi Yakini, shared on the Female Reporters Leadership Program of the Wole Soyinka Center, Traditional Medicine in Focus, Shogunro, a community where pregnant women find succor in herbal homes. And in that report, she spoke to a certain Babaeja, who I found that very interesting that was the name he was called, who delivers babies in that community. Tell us about the house. You made a description in that report where these deliveries hold.
Okay, that community actually visited that place 3 times on 3 different occasions. Okay, the first time, they have 2 baales in that community. Shogunro is actually 2 communities merged into one. It is called Shogunro Agogu, which the people call Egun. But the real pronunciation is Ogu, the Ogu language of the Badagris. So,
what part of Lagos is this, just to be clear?
Very close to Makoko, shares boundary with Makoko, Shogunro, Agogu, Shoguro and Agogu. Those 3 communities are closely related.
All right,
you can go through Makoko, or you can go through Iwaya to get to the community. Yes. Baba Eja happens to be their savior. In quotes, in that community, because they don't have any primary care center. The nearest primary care center is in Iwaya. And if there is an emergency, the women will be stuck because they have to go through canoe, boat ride to the community if there is an emergency. And sometimes when the water is very low, they can't cross the bridge. They can't cross to the other side of the town.
So tell us about this Babaeja's house. I found that very interesting, and how the deliveries are carried out.
Babaeja's house is better imagined than experienced. It was nothing. It is. You can't even say it is comfortable. It is not manageable.
Wow.
It's a bare floor that has a Macintosh by a side of it where the women deliver, and that same room is his house.
Oh wow!
It is not demarcated in any form. You have
a single room where he lives.
Single room with untarred floor.
Okay.
And you have all his certificates hung around the room, and you have all the concoction, the herbal drugs, the herbal mixture. You have them on the table, very dirty, so unkempt.
But that's where the babies are born.
Yes.
When you say certificates, what did you
that
see?
That is a certified tradomedics.
Okay. Oh, I see.
Okay.
Dr. Omoshayidemi, let's talk about this certification. In that report, which he has mentioned, Babaeja has certificates hung on the wall, but he bears these babies on the bare floor with Macintosh and then wrapper spread in the same room where he lives. Now, traditional birth attendants, can we call them professionals, and when can we categorize them as professionals?
Thank you so much. I've heard what you have been saying, but the issue at hand is, first of all, to find out whether the traditional birth attendants are essential in our healthcare system. When you look at our country, she has spoken a lot at length, whether they have primary health center there or not, whether the primary health center is located. I know the place where she's talking about. That is Makoko. These people have been neglected for so long. But you have to look at the importance of traditional birth attendants. We are in a country of 200 million people, where we have only 30 doctors, 100,000 patients. We are in a country of 200 million people, where you have only 100 nurses to 100,000 patients. You are in a country where you have only 89 midwives, 100,000 patients. What do you expect those people to be doing? Normally, people have to deliver their babies. But when they have been neglected, that is why you have to see these traditional birth attendants. And we should know historically, before the advent of hospitals, these are the people that have been providing health care for the people. And what Lagos State has recognized, because when in 1978, Alma Ata Declaration, the World Health Organization has informed all the nations of the world they know that we are going to have shortage of human resource for health. Because the depends on the human resource. And a nation without human resource for health, a nation like this thing, as our country present.
Dr. Moshayidemi, I'm sorry, your line is breaking up, but let's try again if we can hear you. Could you take the last few sentences again?
Yes, I told you that a nation that has low human resource for health is a nation. As I've said to you, we don't have doctors, we don't have nurses, we don't have midwives. The one we don't even have are leaving the countries because of the conditions of services. And in Makoko, because I can talk to you about Makoko, because we have tried to do intervention services at Makoko, what we have been able to do through IROS, Iroko Health Initiative, an NGO that is in partnership with Swiss organization, people from Switzerland, at Makoko, we have seen it, as we have seen in other parts of the country. People are dying. There is high incidence of maternal and infant mortality. And Nigeria is one of the highest after some few countries. What do we need to do? We have to be innovative in our healthcare system. But a lot of people that in our healthcare system, they are just copying from Western world. These traditional birth attendants, they are there. They are easily available. They are easily accessible. They are affordable and culturally acceptable.
Dr. Moshayide, I'm sorry. Let me butt in here because I have a very. Can you hear me, Dr. Moshayide?
Yes.
Please tell us. Yes, I totally get what you're saying. That we have shortages in every area of our healthcare delivery system. But the question is, does that justify not having standards?
Does that justify what?
Not having standards.
Standard? Who is setting the standard? Do you have standard, any standard of anything in this country? What is your standard? Tell me, is it the Grand Shaku Primary Health Care Center you are calling a standard? When people came, they wanted to help these people and develop the primary health care center that is available at Ayetoro. But due to certain people, they said it's not possible. So what do you want those people to do?
Are you saying, Dr. Omoshayinde, are you saying that traditional birth attendants don't need to have standards?
No, they do. They are being registered. They are being registered. They are being trained. Let me tell you something. Human being is a product of his environment. In Makoko, go and see how people live in Makoko. Go and see whether they have a government presence there. Go and see whether anything is happening to them. What do you expect those people to do? They will try as much as possible to create things for themselves.
That's right.
So that is why we are pointing it out that there is need for us to monitor these traditional birth attendants, bring them out, retrain them, and not that they just be hiding in one place.
Okay, let me hold you 1 minute, Dr. Moshayinde, and let's speak with Mrs. Adeyinka Olumade Kilani. She's a traditional birth attendant. She's a chief executive Olumade Natural Clinic and Maternity Home. Madam, she's right here with us in the studio. Please tell us about your maternity home and how did you start this job? When did you start it? How were you trained? Was it handed over to you from your parents? Is it a religious house? Tell us about it.
Yes, thanks to Dr. Moshayinde for encouraging us to go on training. Okay. I started my own training since.
I can't hear her. She can't
yes, let me hold you a minute. Madam, I would like you to please come to this seat. Yeah, I think there's something wrong with the mic. Okay. Please let's hold on while she adjusts and uses another mic so we can hear her better. Sorry about that.
Okay.
Okay, please move closer to your mic and let's see how that goes.
Yeah. So, I started my own clinic since 10 years ago, my own personal clinic. But I was with my dad over 30 years ago on this line. Okay. And what I'm hearing today is another story about the TBA.
Okay.
Our own clinic on our own area. If you enter my own clinic, let me say my own clinic. Okay. If you enter my own maternity home, you thought you're in a general hospital.
Oh, wow.
And I still run a Trado Medical Center.
Okay.
All my drugs, my herbal are brand.
Okay.
If you want to take any herbal from me, it must be branded.
Okay.
Registered, approved by NAFDAC.
No, once you are a Trado Medical person,
practitioner,
Lagos State Medicine Board.
Okay.
You have to produce your herbal that you use for your patient.
You have to present it to the board.
Yes.
Okay.
So
And
they do testing
they
on these
test
drugs and they approve the drugs, or what's the process when you present it to the board?
It's normal process that our forefather do.
Okay.
But we do brand our
Point
own.
of correction, madam. Point of correction, please. You are distorting facts.
Tell us about that fact, sir.
Please, I was the chairman of Lagos State Traditional Medicine Board. We are the one doing registration of practitioners.
Yes.
There are steps need to be taken before you are accredited. You must have been practicing for a while, and you must have been identified by people. But on the issue of the herbal product,
Yes.
there are two ways herbal products are licensed.
Okay.
There's one, the any herbal products that you are trying to commercialize and be selling, that is the one you need at NAFDAC. But the one you prepare for your patient, in your clinic, doesn't have to be registered by NAFDAC.
Okay.
All he needs to do is that this product is there, they don't register that one. But the one that you are going to package and label and send out, what they do at the board is that we ask the practitioners to name the kind of herbal products they use.
Okay.
And after that, we are going to have an herbarium of it. We will identify the plant. Then we have students coming from University of Lagos doing IT with us. They will go and classify the plants, the students in botany. Then we give this one to the researcher. So that is how they do it. It's not that they bring their products and register.
Okay, I think you're virtually on the same page. She was talking about the herbs that she produces herself. So tell us more about this. Yes,
I'm
sir.
not telling you the process.
Yes, thank you for clearing. Thank you for clearing that out, madam. Please go ahead. Tell us about. I'm interested in what.
Why I go to that point that you said that you met Babaja, later the room with Abba concussion, that. That's how he does his own.
Okay.
In other maternity home, it's not like that. Because before ever they register you, they will come to search and verify your area.
Okay.
Before anybody give you license or register you.
Okay.
So I don't know what of that Babaja. Maybe how the area is. But in our own area, in Ikorodu area, go around and check. Any maternity home you see, as in Trado, very clean and healthy environment.
We will go there to check. But let me ask you, as a traditional birth attendant, do you see yourself as a professional?
Yes, ma. Very well, ma.
Sure.
So I know what I'm doing.
You are professional.
Achike, let me come to you. Dr. Bumi said earlier on that we have shortages, and we do know that we have shortages. And TBA practitioners, they actually feel a void. I mean, you can't have a void in any society. But my question here is to you, Achike, as a policy and development expert, how can we ensure that we empower the TBAs more? Because we have a problem of poverty, on our hands, as Bumi rightly said earlier on. Poverty is very key and very instrumental. Most women at the grassroots, they don't have money to go to, a private hospital, because the general hospital will just be there. They will tell you that there are no bed spaces. Now they are left to the TBAs. How can we ensure that we empower the TBAs more?
Yeah, the doctor online has said something. He said that people are a product of the environment. Institutions that exist in the environment are a product of the generality of the structure of the state. In this case, the Nigerian state. And so you cannot give what you do not have. Because all of these conversations that we have had point to one thing, that we have a major crisis in healthcare delivery system in Nigeria, across board. And that is why when Bill Gates came to the country, he looked at two sectors of the country, looked at education, looked at healthcare, that they are fundamental for building a nation. You cannot build a nation of sick people. You cannot build a nation, of people who are not educated. And so it is critical. And we have also established the fact that, even from the statistics given by Dr. Bumi, that virtually every indicator that should be positive in the healthcare industry in Nigeria is in the negative. In terms of, and then again, when you talked about the medical facilities we have in the country, in Lagos State, it was horrible. You have 26 hospitals.
Yes, general hospitals.
200 there. You have about 200 and something healthcare centers in the country.
And then you have 2,886
and 86 private hospitals, and so on, for a population of 18 to 22 million people in Lagos. And so it tells you that we have a crisis. And so obviously the alternative has to be looked at. And that was why I think the doctor talked about innovation as critical to whatever we're going to do. And that goes to even what the question Sheriff is asking. It means that having seen that the government, there's no way the government can close the gap. Because even the ones that are being trained in our hospitals, in our universities and tertiary institutions in this country, at the slightest opportunity they have, they leave the country to go and give their services to other countries. And so we are losing so much. Those who are not able to do that are the people within the rural areas. Are those people with very minimal economic advantages. And so the government now has a duty to target these people and to see how not just to take care of, to look at it from two fronts. The ones that are existing, how do we improve on what they are doing? How do we help them with infrastructure? How do we help them, for instance, the Babeja, and Bumi, you've done a wonderful job. Seriously, you said you've been doing this for the past 7 years.
Yeah.
Over
7 years.
Over 7 years. And if not any other thing, I think it is passion that is driving you. And I must also feel that somehow at the end of the day, you must have felt so much disillusionment and depression, over the kind of squalor that you see Nigerians going through. I know it can also be very, very depressing.
That's right.
But then the reality is that having recognized the fact that this is the deficit we have, and that more than the universities, the traditional TBAs are in a position to try to close the gap to some extent.
Because they are closer to the people.
Yes,
that's right.
Because they are closer to the people. So, I mean, the reality is that when a person is running a business, even a private business, and he runs short of infrastructure and funding, he goes to the banks to look for a way to shore up his businesses. Now, this is a matter of national emergency. The lives of the citizens of this country are involved. And you would expect that once a government is in the know that this exactly is what is going on, that the government will pull out all the stops, do everything that is necessary to encourage, you understand, the people that are already there, so that they don't get frustrated and leave. How can we have a situation? The Babeja even incidents is even annoying to me. And he's done so much, and you cannot blame the man. He's giving only what he has.
In fact, according to that report, I think he has birthed 200 of babies in that community.
The fact that people see him in quote as their savior from what Bumi was saying,
yes,
it tells you that there is something positive about what he has been doing.
We need to go on our very first break.
Improved upon.
We need to go on our very first break. Dr. Bumi, I'll ask you to please hold the line while we go on this break. We still have a full house here in the studio. Remember, you can watch us live on Facebook, Twitter, also on YouTube, Nigeria Info FM. Approximately over 100 Nigerian women die every day from causes related to childbirth. This is what we're focusing on today: maternal health, the role of traditional birth attendants, and of course traditional medicine in deliveries of these babies. After the break, we'll be right back for more conversations. I'm Wemimo Adewuni.
And I'm Sheriff Quadry.
Talk, news and sports after this.
99.3 Nigeria Info.
We are back on the Morning Crossfire 99.3 Nigeria Info. If you're just joining us, well, you're in time for the last half of the conversation. Today we're focusing on maternal health and the role of traditional birth attendants in delivery of babies and maternal health. We have a full house today. Remember, this is in partnership with the Wole Soyinka Center for Investigative Journalism, and journalists on the Female Reporters Leadership Program join us every Friday. Female reporters sharing the stories about women that they have done. Wemimo Akini works with Radio Nigeria, and she's here. We're looking at her report today, Shoguro, a community where pregnant women find succor in herbal homes. Wemimo, thanks for being here still.
Thank you.
On the line, we have Dr. Bumi Omoshayide, who's the ex-chairman of the Lagos State Traditional Medicine Board. Thanks for holding the line, sir.
Thank you.
And right here in the studio, Achike Chude is here. Achike, you've been here from the front
Always
pages.
a pleasure.
Thank you. We also have Mrs. Adeyinka Olumade Kilani. She's a chief executive, Olumade Natural Clinic and Maternity Home. She's a traditional birth attendant. Madam, thanks for being here still. Now, let's talk about miracle deliveries. Now, many people who go to traditional birth attendant expect that these herbs or some prayers would help them through their deliveries and there will be no complications whatsoever. The reason we have a high rate of mortality, maternal mortality, is that there are complications either during the pregnancy or at delivery. So do you also have miracle deliveries? How do you manage complications during antenatal and during deliveries?
First of all, there's no miracle.
Please, I need you to speak to your mic.
There's no miracle delivery.
Okay.
Hello?
All to God.
Yes, sir. Can you hear us?
The person speaking, please.
Okay, she's here.
There's no
Because
miracle delivery.
we are talking about complications.
Yes, that's one of the guests in the studio.
I like the line. I like the lines of your questions.
Yeah, 1 minute, doctor. 1 minute, doctor. 1 minute, doctor. I'll come to you shortly. Please let her answer the question. Thank you.
There's no miracle delivery. All is normal delivery. Once you smell a funny stage, before get out of hand, refer the patient immediately.
Okay.
I don't believe in any miracle.
Okay.
We do our normal job. With God, everything is possible.
Tell me about antenatal care. How do you do this? How do you check the baby? How are you sure the baby is well and the mother is well?
When the patient registers with us, first we take the data, know the history, the past history. Normally, we don't accept the first timer. That's a primate. We don't normally attend to them because they are very tough.
Okay.
At the same time, we do call them like a person that born like 4, 5.
Okay.
Also very tough.
Okay.
So in between 2, 3, 4, we can surely attend to the woman.
So what do you do with those ones that you say that you almost all the time avoid?
In my own clinic, let's say in my own clinic, once I take your data, I know you're a first timer, I will pamper you to the general hospital.
Okay.
There's a way to talk to them that you will understand.
Okay.
Because if you just talk to them anyhow, they may go to another place and it may be danger to their health. You counsel them, come for your own good. Let's go this way. I can even follow them up
Okay.
Very
to
good.
register and be following them till they deliver. Second, the first stage, second stage, let's say second born is very easy. Third born, very easy. Fourth, but the fifth one, if you love yourself and you have your clinic and you love to enjoy yourself, you better refer the person.
The patient.
So when they come newly, you take the data normal, know the past history, monitor the fetal signs, because they taught us how to use speak, thermometer, weight to know the state of the earth.
Okay. So
along the line, if you smell anything funny, let me put it this way. Like the patient came last week with so BP, and the following week the BP change. There's something fishy
going on.
So you have to be partnered to PHC or General Hospital.
Okay.
You have to be friendly with them.
Okay.
Madam, you need to see matron so. Go to the health center. This your cakes is normal. So the person will go. With that, there will not be a problem.
Okay.
So to me, there's no miracle delivery.
Do you use scans? Are there scans done to see the baby?
Yes.
You ask them to
Yes.
do
They will
scans.
do scan. They do screening to know the status of the patient.
Hmm.
Some they will lie for you. Maybe they are HIV patients.
Okay.
They may be go to general hospital before and discover that this patient has HIV. The next is to run to our center to cover up. But once you do the screening, we surely know that you are not my patient. Because taking the delivery, you are not helping her, you are not helping yourself.
Let's talk about antenatal care. I mean, for mothers who go to the hospitals, you're placed on pills and all. What do they use?
In our maternity, we use herb.
Okay.
We use herb, purely herb.
Okay.
All these herb we are talking of, they have their own benefit and the stage. When you're in first stage, like first 3 months, we have the herb we use for you, for the baby to strong and yourself to strong. When you get to, let's say, the 1st month, the 5th month, there's another method we use till you deliver. There's no pill, purely herb.
Interesting.
And it's very essential.
Dr. Moshanyide, let me come to you very quickly. Let's take up from where Mrs. Adeyinka stopped, and that's complication. How to identify complications. The maternal mortality ratio in Nigeria is about 545 out of every 100,000 live births. That is unforgivable. Lagos State has about 450 out of 100,000 live births. That is just unfathomable. My question is, we cannot totally say that because we have shortages in all of these areas, we won't do anything to check this. How do we make sure that we reduce the number of deaths by our babies, coming from complications? How do we make sure of this? Because we cannot remove the TBAs from this whole calculation now. But how do we ensure that we make them more effective to ensure that any complication whatsoever can be handled professionally?
Hello.
Yes, doctor. Can you hear us?
Yes, I can hear you.
Yeah, that question was for you. Okay.
Let me just explain to you.
Okay.
The lady that has just spoken, I'm very proud of her. She's a product of our innovative ideas in Lagos State to train our TBAs. She will have told you the process they have gone through if she has been registered by the board. Normally, we bring them to the board because we need to reduce infant mortality and maternal death. And what are the major complications arise from bleeding, fever, all those infectious diseases? But the point is that how can we stop this one?
Exactly.
We have to train the people that are usually in first contact with the patient, and which are the traditional birth attendants. So what we did is that we send them to traditional medicine board where they have 6 weeks orientation, learning about human body, physiology, how to take history, and how to prepare and how to make the environment conducive and hygienic. Then after that, we send them for 6-week training at the general hospitals around them so that they can see cases that are bad. And in the process, we develop a very referral system because now we taught them that they need to do scans, they need to do blood investigation. So we are trying to bring all those parameters that are utilized in managing patients in the orthodox way and give them as a weapon so that they can use, so that in order to save our people. The problem now is not who does what, but how it is done. You understand what I'm saying? So
my worry, however, sir, is that I am not certain, unless you're sure about the numbers, that we have captured all the traditional birth attendants in Lagos and they've all been trained.
Let me tell you, my sister.
Yes, please.
We are living in a nation that is based on falsehood. We don't know the number of people we are.
That's
we don't
right.
have
True that.
statistics.
True that.
You understand? We don't have data. We don't know our populations. In your community, you don't know how many people you have there. So how will you know number of people you are going to plan for? First of all, we must be able to have data how many we in each different community. From there, we can be able to sieve out how many traditional birth attendants are available. What we have been doing is that we send our inspectorate and monitoring committee outside so that they can detect those people. Initially, people were hiding because whenever they take patients to the general hospital will reject them coming from the TBA or coming from home. But there's a law in Lagos that any patient that comes from anywhere the patients must be taken.
Yeah.
Then make sure you save the patient's life. But with our effective referral system, we have been trying to reduce, because now the TBAs that have been trained, they know that there are certain cases that they must not take. They must refer immediately when the patient comes to them. And how would they be able to do this? It's because we train them that there is things for them to have laboratory investigation. They will know whether the patient is anemic, whether the patient is having infection, and also to have it done so that they can know the position of the baby, the weight of the baby, and the length of the baby, so that they can be able to avoid complications. But if you can transmit all the same ideas all over the nation, we will have a very great reduction in our traditional in our maternal health.
Fantastic idea you've raised there. Let me come back to Bumi in the studio. The question again, I mean, you raised a fantastic point about poverty. But the question I asked, I attended a meeting between traditional birth attendants and doctors, and the clash that happened there was, primary health care centers are actually cheap. Delivery is just about 3,000 to 5,000 naira at the primary health care centers. And other TBAs, by the time you calculate how much you spend on herbs, and in some places in the goats you buy, for some who believe in the religious, way, if you calculate how much you spend, you could just have spent the same amount at the primary care health center and get, orthodox treatment. In your reporting, in going through these communities, do you think that, going to the hospital is truly more expensive than these birth attendants?
For the women, I think it is very expensive, not just more. Very, very expensive. So they have to make do with the TBAs around them. And for a fact, I know that in 2015, 2016, I think, Lagos State introduced the midwifery scheme, where retired midwives are called back into the system to train them to be part of the healthcare services. But I don't know how that has been so far. And let's take Babaija's case, for example. He has a nurse who works with him.
Okay.
When he feels there is complication that may set in.
A trained nurse?
You're not sure?
I wouldn't know if it's a trained nurse, but the woman is a nurse.
Okay.
Oh.
So she comes in anytime there is complication, according to Babaija.
Okay.
Now, and I spoke with a lot of these women. Their issues are the same. And what they are saying is the same. They are cheaper. TBAs are more cheaper and very close to them than the primary health care. The primary health care center in 7 Makoko, Ogu, Agogu, and Shoguro is in Iwaya.
Just one?
I think, yeah.
Did these women tell you how much it costs them to attend?
Said, yes. To register, she paid 5,000 naira if she's good. No, one of them said she registered for antenatal in Iwaya. She paid 5,000 naira to register, and if she's going every Tuesday, she pays 1,000 naira
to see a doctor.
To see, yeah.
So how much do they pay to Babaija?
Babaija is maybe sometimes they don't even pay. According to Babaija, sometimes he takes the delivery and he doesn't see them.
Oh.
They disappear with the baby.
They disappear they'll just say Baba Mumbo. They'll not return to pay the Baba. So I think most of the jobs he's doing there is just kind of a charity work for these women, because he's closest to them than the PHC or the general hospital or even the private hospital.
Can you relate? You're shaking your head. Can you relate to this?
Do you have patients who run away?
Yes, at times they will deliver.
Please speak to your mic.
Starting to beg you, mommy, you can see no money, no this. You have to let them go.
Oh, wow.
I can't hear you, please.
In some cases, sir,
yes,
they will come and deliver. Later be begging. No money, no this. We come back to pay you, mommy. Trust me, and you have to let them go.
In the hospitals, I'm not sure this happens. If you're not able to pay, you'll be kept.
In my maternity home, I will not be comfortable.
Okay.
So I will allow them to go. If you like, come back and pay my money.
Wow.
If you don't like, left to God.
Wow.
I was in one of the general hospitals in Lagos, the one closest to us. And we went there for a charity work, right? And the nurse in charge said she has like 7 mothers who have delivered for like 3 weeks. They've not paid their bills and they're still there. And the thing is reading.
The
Because
bill is
every day
accumulating.
Yes,
Of course.
the number of time they spend in the hospital, your
Bed
bill is
space.
accumulating.
So we have a big challenge here, which would be that,
We tried it.
yes, in the trial, people feel more connected to
Yeah,
these
more at
people.
home.
They're more at home.
Let me just add another point why people go to the traditional birth attendant.
Okay, sir.
It is cultural. And it is the way those people accept them. Because they know them within the community. Most of the TBAs will have delivered, when they live in the community, might have delivered their mothers, will have delivered their sisters, so you can know their history better. And the accessibility, which is one of the components of primary health care, and is cultural acceptable to them. And another thing is that the attitudes of our health workers at the most primary health care centers makes the patient not to be driven to that place. Sometimes they are outside to the patient because it's not their fault, it's because of the pressure of work. But when someone is very comfortable, sit at the traditional birth attendant home, they will joke, they will gist, and so on and so forth.
And maybe even share a plate of food while you're at it.
And sometimes, as you rightly said, most of them don't pay. It happens in Orthodox hospital. I used to run Orthodox medical center. I'm a medical doctor by profession. So most of the patients might not be able to pay. They will run. You see the husband running away. But it takes his heart to allow them to go. And that is why they always prefer to, because they know the traditional birth attendant person will not detain them as they are being detained in most of
In
the
the
Orthodox
hospital.
hospitals.
Before we head to
So
the
that's
phones to
why
take
that's
calls,
them to them.
before we
Yeah.
head to the phones to take some calls, Achike, there's a report done by, there's a projection by the UN. Right now, our population growth is about 2.6%. That's the rate at which the country grows. There's a projection that by 2050, Nigeria will become the world's third largest country by population. Do you think there's a need to regulate our population, like what China did, to say have 2 children or have 3 children that you're sure you can cater for and give quality healthcare?
Yeah, China also to some extent regretted that move.
Yes, they did. Yeah, they
some
did.
point.
Because
That's right.
they got to a point where girls will be kidnapped and then taken by some families and then shared among the male children there.
Shared indeed.
It was happening.
Yes.
And so, because the reality is that when you go against the force of nature, there's a consequence sooner or later. That is not to say that you have unrestricted, birth, because it's all about planning. In your home, you need to plan your budget, and you need to plan your budget against with regards to the members of the family, how many children, the school, and all of those things, so that you can give them a quality, upbringing in terms of education and so many other things. And so it is critical that we take a look at that. But obviously, much more important is the need for us to also do the right thing as citizens of this country. I think Dr. Bumi on board sometimes when he talks and he says, look, what is the character, what is the nature? He asks questions that border on governance in this country.
Yes.
A country that has so much resources, a country that has been blessed, virtually every part of the country that you look at, people are looking at oil and concentrating on oil. But the reality is that there are certain mineral resources in this country that will give oil a run for their money.
That's right.
So you have so when people define population only on the basis of the numbers, I say no, that's not the proper definition of population.
Thank you, my brother.
Population is defined on the basis of the potentials, of the basis of the resources available to a country. You talk about countries like Israel. They do not have land. They do not have fertile land and the rest, but they have been able to generate water from the air. And so on. So we have an irresponsible political elite in this country that are only interested in their self-gratification, in putting monies in their pockets and in bank accounts, while the rest of the people wallow in poverty. Tomorrow, the resources of the country are not enough to take care of the basic needs of the citizens. Now, the politicians turn around and say you have a large population. Let us look at the root causes, while also looking at the need to also know that we need to plan the population. After that's why we have a census. That is the essence of having a census, so that you can begin to plan for healthcare, plan for education, plan for infrastructure, and so many other things. Yes.
That's a very passionate one, but we have to go to the phones right now. Here are the phone numbers. You can join us now.
Call us on 0127709993, 0127719993, 0127729993, and 0127739993. This is Nigeria Info. We are listening.
All right, this is Nigeria Info. We are listening. Let's get to the phones. We have Anonymous on the line.
That's right.
Good morning, Anonymous.
Hello, good morning.
Good morning.
Thank you for this program.
Thank you for joining.
I want to let you know our government, Nigeria government, have failed woefully. Why do I say that? I mean, he go to General Hospital last Upper Friday with my sister-in-law. This woman has psychiatric problems. We were there. Nobody to hold this woman. It is only me and the senior brother. The senior brother don't have power to hold this woman so that they will give him injection. Nobody, it's only me. On the process, this woman will injure me. The security are there, looking at us, laughing at us.
Oh dear, laughing.
So the husband have to go. The security demand. The husband have to go to Arrow Hospital. If you look at the bill, almost 100,000. The man cannot afford it.
I'm so sorry to hear that.
The woman is there now making problem. No help, nothing.
Wow.
The government has failed woefully. So all these traditional people, they are there to help people.
All right.
Thank you so much for sharing. I'm so sorry about the situation. Dr. Tuyi, I'm sure, is on the line. Good morning.
Good morning.
Dr. Tuyi.
Good morning. Good morning.
Thank you for joining us. Good morning.
Good morning.
I know this interests you. Share with us briefly.
Really. Dr. Bumbiamo saying to me, good morning.
Good morning.
We know very well. So our ladies in the studio, Sherry Quadry and Achike, good morning.
Thank you. Good morning. Yes.
Let me tell you my concern. I am so passionate about maternal health and even the health system in the country. My major concern is this. We should be careful not to create a discriminatory healthcare services in this country. What do I mean by this? We're looking at it that, okay, these guys are poor, they are rural, they are just hanging out there. Let's create this kind of health system for them. But whereas the other people are here, and they are in the center of the town, let's give them a better health system. Health system is not run like that. It must be equitable. Now, let me just create an example that will hone in this properly. Supposing we have our health system running very well, very, very well. I'm talking about the primary healthcare system, the secondary and tertiary healthcare system. I also have the traditional birth system running very well. The question is that, will you now take any of your wife, Quadry, will you take your wife now to a traditional birth attendant for delivery? You have those health systems running properly. That is very
so providing equity for people living across communities.
Equity has to happen. Now we are gradually sliding into what I call culture of ossification and zombie orthodoxies. We are just trying to say, okay, wait a minute, it has been happening like this in our prayers. It has to remain like that because we cannot then deliver quality health care to ourselves.
Right. Thank you, Dr. Tuyi. Yeah,
let me just on that.
Okay, please. We have many people on the line.
Okay, the thing I want to say is that yes, there's a role for TBA, traditional birth attendants. We must be able to let them assist us in family planning, health education, and linkage to real centers. There's no way TBA anywhere. I have studies that show that TBA has been counterproductive in other countries and they've stopped it. Thank you.
Thank you so much. Ekundayo has been on the line for a while. Ekundayo, thank you for holding the line.
Yeah, thank you, Wemimo.
Welcome.
Fine, thanks.
Ekundayo, could you speak a bit louder?
Yeah, I find your program very, very useful.
Thank you.
This issue of traditional birth attendants, I think that the Lagos state government has done the right thing. But they do not need to rest on their oars. I had the contribution of the traditional birth attendant in the studio, and you need to ask her, since she says she has been practicing for about 7 years or so, has she gone for any form of retraining? You see, because
you mean the traditional birth attendant in the studio?
The state of health too. Okay. And available health care is also changing.
That's right.
So such people, they need to retrain them.
That's right. Thank you.
People like Dr. Moshe, they need to come in You know, whatever they can do for the Lagos state government, maybe to the special advisor to the governor and so on. All these people, they need to retrain them.
All right, Kondaya, thank you.
Thank you very much. Let's ask you, Mrs. Adeyinka, have you gone for trainings, and how often do you go for retraining?
Yeah, they do.
Nearly every year. We go for training, a seminar.
Yeah.
Even in a year, we attend up to 4 seminars in a year.
Wow.
6.
Wow, that's amazing.
Okay.
That's amazing. Let's take a final call.
Lagos is really trying for our trado.
Yeah, that's
really
amazing.
trying for us.
Let's take a final call right now. Good morning.
Good morning.
Good morning.
Wemimo.
Morning.
Yeah, I'm Okosi.
Yes, please go ahead.
Go on, please.
I love the way Lagos State government, they are trying in the area of healthcare. But what I'm trying to say, if the government be able to try as much as they can to develop all these rural areas, as I'm in Okota, near Isolo here, I always go to General Hospital Isolo and see the area, the level of trying they are trying. So I appreciate what they are doing.
All right.
What I'm trying to say that they let them try as much as they can to develop all the traditional ones too.
Thank you very much. Thank you. We do appreciate the call. Bumi does not agree with you that Lagos State is trying in terms of healthcare. I saw you shaking your head while he was on that call.
Do you think Lagos is trying?
They are not. They have tried,
Hello.
but they need to try more.
Uh-huh.
More, yeah, because we have a lot of primary health care centers. Most of them are not functional.
Okay.
Yeah,
Yes.
true that. I've seen quite a number. But let's wrap it up right now. It's been a great conversation. Thank you all for joining us this hour. We've been live on Facebook, Twitter, and also on YouTube. What that means is that you can watch a replay of this conversation anytime you like. Big thanks to our guests on the show today who have joined us, Bumi Akini from Radio Nigeria, Radio 1 precisely. Thank you for that amazing report, and thanks for joining us. Also on the phone, we've had Dr. Bumi Omoshaindemi, ex-chairman of the Lagos State Traditional Medicine Board. Thank you, sir, for your time.
Thank you.
Achike Chude, it's been
Always
here.
a pleasure.
Thank you. And also Mrs. Adeyinka Olumade Kilani. She's a chief executive, Olumade Natural Clinic and Maternity Home. Thank you, madam.
Thank you.
Nigeria, we'll be seeing you again on Monday.
That's right.
That's it. That's a wrap on the Morning Crossfire for the week. Amazing. Big thanks to Tosin Akeride, Yvonne Ohafo, and also Zainab Yakin for assisting on the show today. After the news at 9, Tunji Andrews will be here with money, business, and economy. We'll see you again on Monday. I'm Wemimo Adewuni.
And I'm Sheriff Quadry.
Have a great weekend.
More news and information coming up. We'll be back.